Welcome back. As I said in our introduction early this morning, we'll be talking about urticaria or skin problems that we might encounter during the winter. And joining us this morning is Dr. Munir William Labib, Professor of Plastic Surgery and Treatment of Obesity. Thank you so much for being with us.
Thank you.
Indeed. Thank you very much, Doctor, for joining us this morning. And let's start by a quick definition of what is urticaria.
Urticaria simply is a disease in which we find there are circular red areas in which scattered all over the body. These circular hot areas are hot and elevated above the skin. They are present for a certain period and then disappears and returns back to appear in certain areas. So we find red elevated areas which are hot, followed or surrounded by also red areas, and these areas disappears after 2 to 3 hours and return and appears again in another areas all over the body. This is urticaria, and for us it is one of the most common diseases. We find nearly 1/6 of all population all over the world are suffering from urticaria once per life, at least once per life. So this disease is common and is popular.
Okay, what causes urticaria?
Urticaria has many causes. To start with is diet, our food. There are certain persons who are suffering from urticaria related to certain types of food, such as banana, such as fish, such as mango, such as milks, certain types of milks, and so on. This is the first cause. Other cause is related to the psychic element. Some patients return to certain psychic problem, and then these areas of scattered, diffuse urticaria all over the body appears. Third cause is related to something ingested. It's something taken through ingestion. For example, penicillin, certain types of drugs as penicillins, ampicillins, and aminoacids, and so on. Certain groups of drugs can cause urticaria. Also, we can find urticaria related to insect bites, such as ants, such as bees, and so on. Also, you can find urticaria related to certain parasites, such as Ascaris and Ankylostoma, and so on. Also, urticaria may be related to something inhaled, such as the hair of dogs, hairs of cats can cause this urticaria. So there are many, many causes. And for us, we can say that everything below the sun, even the sun itself, can cause urticaria. So in the winter, we find urticaria in winter. In summer, we find certain types of urticaria related to summer. Taking the roots in our clothes might cause urticaria, and so on. Everything related to the sun, even the sun itself, can cause urticaria.
So urticaria is also a timely disease that you can get. For example, some people only get urticaria in certain periods of the year, like every January, some spots appear on my hands, so this is related to the time of the year. Is that correct?
Yes, this type of urticaria is called related to cold pressure, and it is called cold urticaria. And there is another hot urticaria, and there is iatrogenic urticaria, and there is urticaria related to psychic problems, and so on. And so this makes us very difficult to diagnose urticaria, the cause of urticaria. What is the main cause of urticaria? Here, there are many tests are done. The main test, of course, is what is known as patch test, but all these tests are useless. They are of no rule. And for us, the experience of the doctor and the experience of the patient himself are very important in diagnosis of what is the cause of urticaria.
Yes. Usually, how long does it last?
Usually it lasts for 2 to 3 hours, but it is very important that if urticaria comes in the larynx, it makes difficulty in breathing. So it is a serious
on
type.
your skin, when it comes on your skin, it causes...
It comes to the mucous membrane and the skin. The skin is what is for us, mucous membrane what is inside. So it may come to causes difficulty in breathing or difficulty in swallowing, or it may affect the genital areas and makes many problems related to micturition and retention of urine and so on. This is the severe type of urticaria, which needs to be the patient to be in the intensive care.
What causes the severity of urticaria?
This is related to the patient himself. We can't go, this is severe and this is not severe and this is palm and so on. This is related to the cause of urticaria and the skin immunity of the patient himself. But the severe type of urticaria may end in an opening in the neck in order to leave the patient to breathe. Otherwise, he will die. Or some case of urticaria, we may put Riley tube in order to feed the patient, otherwise he cannot eat. Many cases of urticaria may lead in retention water to put catheter and make catheterization. So here lies the severity
Could
of
it be
urticaria.
fatal? What you're saying means that it could be fatal?
It could be fatal. If
Maybe an
urticaria
extreme,
comes to a child in a severe dose and without good treatment, he may die from difficulty in breathing. So it may affect the life of the patient, of course.
Dr. Munir, of course, this leads me to my next question with regards to the treatment of urticaria. First, is there prevention? Because sometimes they say prevention is better than treatment. And second, what is the possible treatment?
First and second and third is prevention and to know the cause. And then there are many drugs which help life-saving, of course. Groups of drugs such as corticosteroids, such as antihistaminics, and of course the main treatment of urticaria is systemic through the oral mouth and not through creams and so on. Creams are useless usually because you cannot put creams all over the body, but you have to take something systemic in order to relieve. No rule of antibiotic in these cases, except if the urticaria extends for a certain period, becomes regular and becomes more than one time per week and so on. Here may be secondary skin infection and you may in need for antibiotic, but there is no rule for antibiotic. But the main rule comes to corticosteroids, comes to antihistaminics, comes to calcium injection and so on. But the problem lies in what follows urticaria, such as hyperpigmentation in the body, some pigments present scattered all over the body from scratches, from the...
It itches, of course.
Of course, it is itchy. It is itchy, and as we have said, urticaria is red elevated papules, and it is hot and itchy. There is hotness in the area of urticaria, and then this appears and starts to appear in second area and so on.
So hot and red?
And red and elevated and takes 2, 3, 4, 5 hours, and then disappears and comes to appear another area and so on. This is urticaria. There is fleeting.
For a day, for 2, for 3 days, for how long?
It may be follow if the main cause is present, is still present. If the cause is still present, if are coming in place where there is dogs and cats and we are taking and smelling the hair of these cats and that, there is a
But what if it caused, for example, by eating too much fish, and I stop eating fish for days? Would that elevate the skin problem?
If you have stopped the cause, which is fishing, of course, everything is all right. It's all right.
With no medication needed.
But some cases persist and needs medical treatment, of course. But you start fishing, you start eating fish, and there is no problems. After 1 month of fishing, and there is some problem. 3 months and 8 fishing, there is severe problem. Here, the immunity of the body increases towards certain types of foods and starts to make these problems, of course. Yeah.
Doctor, aside from ingestion of medicine, there are other kinds of treatments, for example, peeling and laser treatments. Could you tell us a bit more about these?
Here we are speaking about the scars, or we are speaking about the hyperpigmentation which follows urticaria. If there is hyperpigmentation in certain areas, suppose in the face or suppose in the hand, there may be a rule of peeling. And peeling, of course, may be of one of 3 rules. Either peeling in what is known as fruits, which is present in all houses. The housewife can use certain types of fruits by different concentrations, very low different concentration, and this can improve peeling, even if it is present in the face. The second type of peeling is what is known as TCA, which is trichloroacetic acid, and this is the regular type of peeling, which is present in most clinics. But the best type of peeling is what is known by glycolic acid. This is one of the best types of peeling, which can affect the hyperpigmentation and makes it relieved. As for the role of laser, there are certain types of laser which are preying on causes of scratches or hyperpigmentation. For example, there is IBL, which is intensive pulsed light laser, and this can play on hyperpigmentation and relieve this type. There is also carbon dioxide laser, which is very important in relief of this hyperpigmentation. Also can find certain types, other types of laser as NDA laser, as alexandrite laser, but there are special types of laser. The main cause and the main line of treatment using peeling or using laser is shifted towards the presence of hyperpigmentation or scars following urticaria. And this is the rule of peeling, of course. But we return back and say that prevention is better, that we have to know the cause of this type of urticaria, and we have to take severe and quick line of treatment related to antihistaminics, systemic antihistaminics, systemic corticosteroids, systemic and so on, and systemic calcium. This can relieve the case completely, and we have to avoid the cause later on.
Sir, usually from your experience, what are the major problems that skin suffer from during the season of winter?
The main problems in winter, many causes, of course. All types of skin affection can occur in winter. For example, we can find acne vulgaris related to winter, which is acne, which isn't related to winter. Also, we can this urticaria related to winter. Also, you can find certain types of diseases, such as lupus. Lupus is one of the severe causes of diseases which affect maybe localized type, affecting certain areas of the skin, or maybe systemic type, which is fatal. As far as the localized type, which affects the skin, can make papules, can make rash, can make hyperpigmentation, can make many problems related to skin, and it is related to winter. And as I said, lupus affects females more than males. It affects females in the localized type to the males by ratio 9:1, or in the systemic type it affects females to males in the ratio 3:1. So lupus is one of the diseases which affects mainly women and females and young ladies and so on. Also, you can find many other diseases such as eczema related to winter. Also, you can find all types related to insect infection, infestations, such as lice and so on. This related mainly to winter.
Because of the drop in the weather. Doctor, a very quick question as a special request as well. The issue of dark circles under your eyes or over your eyelids, around your eyes. This is a problem in winter and summer and all the time, basically, and it's also a problem for women more than men. Could you tell us a bit more about the reasons behind it and possible treatment or prevention?
This shifts us direct to plastic surgery. Here, hyperpigmentation below the eyes or above over the eyes is related to congenital causes mainly. And of course, it relates to make it up, related to, as you see, lightening, which is excessive, related inside the stones and so on. So the main cause is congenital, but it can promote and make it serious by smoking, by taking alcoholics, by during heavy lightening and so on. But as for me, treatment of this type is related to the skin type. We divide the skin type of all persons all over the world into 6 types. The first type is type 1, which is sensitive, which is light skin type, and type 6 is dark skinned or negrous. So it is related to skin type. For example, all Egyptians are skin type 3 and 4. The main line of treatment for this mainly is what is known as blepharoplasty. We have to remove excess skin and make simple operation, what is known as blepharoplasty. This puts an end to this hyperpigmentation. But there is a role related to certain types of creams and certain types of gels which are present below the eye, and of course avoiding heavy alcohols, avoiding cigarettes and lighting and so on. This leads to this treatment. But the main line of treatment is by plastic surgery. Then this followed by role of laser. Laser can play a simple role, and also there are certain types of creams and gels can play an important role.
Okay. Dr. Nile William Nareed, Professor of Plastic Surgery and Treatment of Obesity, thank you so much for being with us.
Thank you.
Thank you very much.
Discussion.
Indeed. Thank you very much, Doctor. And I guess with that, ladies and gentlemen, we wrap up this morning's edition of The Breakfast Show. We hope you've enjoyed it. I was in the company of Hind Farag. Thank you very much, Hind.
Thank you, Angie. And don't forget to join us again tomorrow for the next edition of Breakfast Show here on Nile.